Kim, the Diabetes MP, and you are tuned in to the Patient Corner. Now, this is a segment that I created in a way to educate those who have diabetes or family friends that have diabetes, in a way to educate you all over the disease. Now, for the month of March, I am going to be covering diabetes complications. This is something that I get a ton of questions over. My colleagues get questions over this as well. So I have to see that this is something that I need to cover. Now, what I plan on doing today and for other videos for the month is I'm going to go over the different common complications that happen to come up with the disease. Now, one complication that I will not be going over, because I've already covered that, is coronary artery disease, heart disease. Back in February, I talked about this disease kind of extensively, this complication. Even had a good colleague of mine that works at a heart clinic to come in, and we just discussed that. So I won't be going over that, but that is a complication. And if you are interested in viewing that video, I will link it in the description box, okay? So let's get into some overview over diabetes complications. Now, diabetes can put you at risk for a lot of different complications. And I talked a little bit about reducing risk in a previous video, and I'll link that video down in the description box. But it could put you at risk for a lot of different complications. And as I stated earlier, I'm not going to go into all of those complications, but I'm going to talk about some of the more common ones that we really try to make sure that we prevent with your diagnosis. Now, we basically divide the complications up into two categories: macrovascular and microvascular. Now, macrovascular talks about the damage that can happen with the large blood vessels in your body. So large blood vessels would be your coronary arteries, like the vessels that are in your heart. It also could be your peripheral arteries. These are the arteries that give blood to your limbs, to your arms, and to your legs. And then also the arteries and blood vessels that supply blood to your brain. So in these situations, you could have heart disease with the coronary artery disease, or you could have peripheral artery disease where you may have some circulation issues. And then the vessels that feed the brain, if there are some issues with those blood vessels, that's where you would see your stroke, and you would start to see issues like that with macrovascular disease. Now, microvascular disease, again, this is the damage that happens in the smaller blood vessels in your body. So what you would see here are the vessels that feed your eyes, the vessels that feed your nerves, where you may have some neuropathy. Some of you all may be dealing with diabetic neuropathy. And then also the vessels that feed your kidneys. And we also know that with the kidneys, we really want to protect those kidneys, because as kidney function declines, you could be put at risk for having to be put on dialysis. So in a nutshell, that's your macrovascular and your microvascular complications. Just a little bit of an overview. Okay, that's all I have for you. This was just a quick little video, just an overview of the diabetes complications. And like I said previously, as we're moving through the month, I'm going to go into the individual common complications that you may see if your diabetes is not under control, or if you have had diabetes for quite a long time. Again, you have been sitting here with Kim E, the Diabetes MP. This is the Patient Corner, and I'll catch you on the next video. Bye.